4 o'clock this afternoon and screening centres for NHS staff are hardly being tested to their limit. We spotted just a couple of cars across 3 separate sites. There weren't many more at lunchtime. This hardly looks like a system delivering results. Having personally had a test for COVID-19 himself, today the Health Secretary had fully recovered. Back in the job, he admitted there is work to be done.
I'm going to level with you about the challenges that we face and the plan we have to rise to those challenges. Unlike some countries, we didn't go into this crisis with a huge diagnostics industry. We have the best scientific labs in the world, but we did not have the scale.
So, like many politicians before him, he has a 5-point plan, all adding up to a new testing target.
I am now setting the goal of 100,000 tests per day by the end of this month. That is the goal, and I am determined that we will get there.
That includes tests to show who has the virus now and who's also had it in the past.
I return from illness more determined than ever to fight this disease. We'll bring together the best minds, we'll bring together the best science that this country has to offer. Because we are in the midst of a war against an invisible enemy. And it is a war in which all of humanity is on the same side.
And on the front line, a promise to test all NHS staff who need one, but little detail on when.
Well, it is still weeks away, and many NHS staff and many people who work in public health have been worried that the testing simply hasn't been quick enough and don't understand why we've not been able to get the equipment that's needed, why we've not used all the laboratories across the country.
Others want mass screening of everyone else to help track the spread.
I do think if we're going to get ourselves back into line with international best practice, we need that community testing. We stopped it 3 weeks ago. At that point, we were actually one of the best in Europe, and that's what brought us the extra 3 weeks, which kept us behind Italy. I hope that today's announcement will mean that we can get back in the fast lane.
Tonight, the Prime Minister made a brief appearance from his self-isolation to applaud the NHS. Due out tomorrow, he'll need to deliver today's targets if he wants history to applaud his efforts.
OK, thanks NHS, thank you.
Paul Brand, News at 10.